Good day, everyone. You are welcome to this episode of Clear My Doubts with Mona Prayer Consult. This is a show where we'll be asking the questions that you are too shy to ask your dentist. So today we'll be discussing on the reason as to why people underestimate oral health. So today with me I have my two amazing doctors, which is
Dr. Harford.
I'm Dr. Kulawale.
thank you so much. So my dear doctors, the very first question I will be asking is why is it that people only visit the dental clinic or the dentist when they are in severe pain?
Okay, so for me, I would say that the reason why people, especially Nigerians, visit dentists when they're in pain is because of their cultural beliefs or the way they grow up. Right? So most persons they don't see they don't take our health serious except in pain. In fact, most Nigerians it's been proven that Nigerians only respond to pain when there's pain. If there's no pain, they have a slow process, no pain, no problem. So if there's no pain, they will not come. Alright, so and because of that, it's only when there is pain that they now come to the dentist. So I feel that cultural bringing, that belief right around the kids is why most Nigerians come to the dentist when there's pain.
Dr. Okawale, what's your opinion on that as well?
Alright, so the cultural belief is one of the major factors why people don't visit the dentist on time. And also, how we can prevent that is to make sure that there is a proper awareness. The people need to be educated. So it's when they are educated, their minds are educated away from that cultural belief. That is when we can now start seeing them coming to the clinic. But with our culture in Nigeria, no.
So with what we have said, does that mean that is the reason why many Nigerians treat oral health as optional instead of something very essential?
Yes, I would say so. It's optional to them because I don't know how to put it now. Most people don't see that there's a lot of they don't think or they don't know that there's a lot of complexity that comes with the oral health. In fact, our mouth is the first pathway to our body. Alright, so everything that goes into our body goes in through the mouth. So if the mouth is the door to your system, don't you think that the door is important? If it's what leads to your full body system. So I think I don't think Nigerians see it from that angle. They just see it as mouth is to chew, and that's all. So I feel that is why they don't come to the dental clinic.
Alright, so that is well said. Your oral health is just as important as your body. And especially when you realize that if anything happens to your mouth, then your body will suffer from it. So we must now try to place more priority and more urgency in going for checkup of our oral health, and also when we notice any abnormality or something different in our mouth, we can take care of it on time. Our oral health is very important, and we detecting at home is very also important. There are some cancer of the mouth that we can discover by just noticing that my mouth is getting whiter or it's getting yellower, the color is changing. That little observation and coming to clinic to present it to the doctor can prevent us from spending billions of money or millions of naira on treatment of cancer in the future, because we can take care of it when it's still small and the situation is solved.
Thank you so much. So can oral infections or let me say gum diseases cause heart problems?
Definitely true. So I've seen some research on that which has proven it to be true both in Nigeria and abroad. So there's a bacteria that causes gum disease. So it is called Piphiromonas gingivalis. So it always finds its way from our mouth, from the gum disease, through the blood system, down to the blood vessels, and it will trigger inflammation there, which can lead to blood clotting and can prevent damage to the heart tissues. So take care of our mouth is just very, very important. Dr. Afford.
It's not negotiable. It's not negotiable.
So thank you. I would ask, like, What is the saddest case that you've seen or that you've observed, and do you feel that this certain case could have been prevented by maybe just normal oral hygiene or just normal toothbrushing techniques, or let me just say just practicing good oral hygiene?
Okay, so I would say first of all that I'm very privileged, right, to see a lot of patients, and I can tell that majority of our cases can be prevented. Majority of dental cases can be prevented if only patients present early enough. All right, but to answer your question, one of the saddest cases that I've seen was there was a time I was in surgery and then a man was brought in to us. He came at A&E, he was unconscious. He was brought in by his two sons, right? And after we did what we did I&D, drainage, and drainage, after we did what we did, he did not recover. We lost that man. But I would to you know that the son said something very profound. He said that the only reason they were able to bring their dad that day was because he was unconscious. And even if he was still conscious, he fought tooth and nail for them not to drag him to the dental clinic, see that it is just his teeth. It was just a single tooth that was infected up here, single tooth that caused what we call cellulitis, and then went and spread to the brain, he lost consciousness, and then he died. Just a single tooth. And he was saying, it is just teeth, it is just teeth. There's another case, so it was a similar case, a man that lost his wife when I was in school. I was still a student. That was the first time I saw that your oral health can lead. If not taken care of, it can lead to death. This man, even after his wife died, he was still saying, tooth the key, tooth the key. His wife was there on the chair. He was in doubt. Tooth the key. They used white clothes. What the white face was saying, tooth the key. The nurses packed the body I was going. He was following them in the back. Tooth the key. That was what he was saying. He was in disbelief. Only if they had presented early. So I think that's like the saddest cases I've seen, because it's, I mean, how much will you pay? And you save your life. So for me, that is like my own take on that.
That has been well said. I've noticed that with my years of clinical experience, that 80% of the dental cases can be prevented by brushing your teeth morning and night and flossing your teeth and going for regular checkup, probably for skin and polishing, and just to check if there's a small hole and just put filling on it. So if people can take their oral health important and they are brushing morning and night, because they are eating morning, afternoon, night. So brush morning and night, then you'll be fine. So that is it.
Wow, this is such an amazing moment. Thank you so much. I really appreciate. So this is just to tell our viewers and their fellow Nigerians that majority of the dental cases can definitely be prevented if adequate care is being taken. So the bone of contention is that you should visit the dental clinic as early as possible, at least twice in a year, so that every necessary checkups can be done. Thank you so much for this amazing moment. Stay tuned and do not forget to watch, to like, to comment on our videos, and stay tuned for the next episode of Clear My Doubt with Mona Boya Consult. Thank you so much.